But my name's Paul. I am from Hospice UK, and I am really privileged and excited to be leading a new stream of work within our organisation to support hospices on their environmental sustainability. And I'm really, really pleased to be kind of introducing you to a really high caliber, stellar cast of speakers who I will introduce in a second. I'll just do some quick housekeeping as you do before that. Just to say that the recording of the session will be available within 10 days after the close of the conference. So please do encourage colleagues as well who may be unable to come along or stream in today to follow that as well and watch that later. And yeah, just finally, just want to thank JDDK, our gold sponsors of the conference. We've got Adam from the firm here today, but really without the support of our sponsors and supporters and exhibitors downstairs, we simply wouldn't be able to put on this event for all of you guys. So thank you very much for your support too. Finally, just to say, please do keep your phones on silent if they're not already. And also the usual notice about in the event of an emergency, you will hear an announcement being made asking everyone to evacuate the venue. The muster point is between the SEC Centre and the SEC Armadillo. So, without further ado, I just wanted to set the scene slightly by saying that having spoken to a number of hospices over the last few months or so, this really is a growing issue across all of the people and all of the different teams that I've spoken to across different hospices right across the country. Pressure really is coming from all sides to be addressing environmental sustainability. That might be from your donors, your staff, your volunteers, your patients, families, trustees, but also commissioners. As we see both in Scotland and England and the rest of the UK, the NHS really push to be carbon net zero by 2040. We know that they are pushing for those NHS organisations to look at their suppliers and contractors to be net zero by 2045. This is going to be something as more and more ICSs and equivalent kind of health systems across the UK ask the constituents of those systems to develop their green plans. This is going to be something that will affect your organisation. So hopefully a really timely conversation today. So first of all, I want to introduce James Byron in a minute. He is Director of Marketing and Engagement at Dorothy House. James has been working in the third sector for over 20 years now, including 7 of those working in environmental conservation. He joined Dorothy House in January 2020 and is responsible for all of the communication and fundraising activities run by the hospice. We will then be hearing from Adam Vaughan. Adam is a director at the Newcastle-based hospice specialists, JDDK Architects, and they've been involved with 50 hospice projects since 1987. Adam leads the practice's sustainability work. He's a certified Passive House designer and Trustmark accredited retrofit coordinator, but he also is co-chair of the Royal Institute for British Architects North East Sustainability Forum. We will then hear from Dr. Kate Crossland. So Dr. Kate is a palliative care senior clinical fellow working in South London at the moment. And Kate is a founding member of the brilliant, if you've not already heard of it, Palliative Care Sustainability Network. Kate has experience working to address climate change right across a variety of fields, from her work in her local community to standing for election for the Green Party. So without further ado, I'm going to hand over to James, and then, as I say, there'll be an opportunity for questions for all of the panellists at the end. So thank you, James.
Great. Well, thank you, everyone. To manage your expectations, that's my only slide, so you're going to be looking at that for about 10 minutes. But my reason for putting that up really is starting context is that's the nicest bit of our hospice building. But, I won't talk to you about the sustainable drainage systems deployed there. We can let an architect do that. But it sits, in the natural environment, and that's always been important to our patient care from that facility. And just on the dip where you can't see them is a solar array that was installed quite a few years ago. So I'm about to talk to you about one chapter, but this sustainability question has been facing the organisations we all work for a long time now. It's not news at all. And so, it's really important that we just think about what's the next thing we can do. And I think that's probably what I'm here for. I'm going to try and, at the end, subvert that sort of the topic of the session a little bit, but just starting with the exam question of the business case, there were two things that really kind of took the whole organisation and made us aware that this was something we needed to be looking at right now. First was 2 or 3 years ago, one of our council commissioners for some of our social care work, that contract was up for renewal, and they gave us the longest questionnaire and looked into our sustainable practice more than anyone had ever done before. We're like, right, okay, so if we want the money to pay for the care, this is really important. And then, as we heard about last night, thinking about our staffing and our recruitment and retention, we looked at our employer value proposition, and that told us we should expect our prospective and current staff to find sustainable issues really important. And then we did a staff survey, and it said exactly that. There's a massive deal for your staff. So, you put those things together to deliver our core strategy. We need some good people and we need some money to pay them. And that's exactly what the sustainable agenda is doing. So, you don't need to look very far beyond that to get there. But I think the reason why I've been asked to speak is that we took a bottom-up approach to this at Dorothy House. So just want to talk you through that as a bit of a case study. But the last thing to say is we know we're still not doing enough. But this is one thing we've done that's positive, so let's share that and celebrate that. So it all started with one of my line reports, who, for the record, would be here under other circumstances speaking rather than me, coming to me and me saying, look, what makes you passionate about working for Dorothy House? How do we bring that into your work? And she said, I really care about sustainability and I just don't think the organisation is doing enough. And obviously that's kind of music to my ears. I'm quite keen on hearing that. But still, so what we said was, okay, well, let's build that into one of your objectives then. Let's do something about that. And that was person one. That was the catalyst of someone coming forward and saying, let's do something. And then we thought about how to do that. We were like, so do we need a sustainability strategy? To be honest, we still probably do. But we decided that wasn't where we wanted to start because we have a load of governance structures. We can pass policy. We have people every day taking decisions within the hospice and how we spend money and how we do things. And what we wanted to do was get that across the entire workforce. And I can remember us saying, okay, well, let's think of it like health and safety. It's everyone's responsibility. You don't have a health and safety officer stood next to everyone in every decision they make. We want the same thing to be true of sustainability in Dorothy House. Okay, how do we do that then? That was our challenge. So we looked at some of the positives, what we're already doing, and then we went into our coffee morning, which is sort of an all-staff, or all staff will actually show up, which is about 40 of them, but that kind of thing, session, and said, let's share some positives. Okay, so do you know the solar array that we've got does the electricity, 80% of the electricity for our inpatient unit? Okay, let's share a positive story, start with what's good, and then let's build on that and say, who wants to be part of making this better? And that very intentionally wasn't, so we need someone from every team to represent the whole organisation. We wanted the whole organisation involved, but actually we wanted a coalition of the willing. We wanted to put together a group of change makers who are ready to do some stuff and make a difference and, have the energy that comes out of that. We called that meeting, virtually, obviously, so people didn't have to drive to it unnecessarily. Interestingly for me, I'm the exec team sponsor of that, but just a normal member of the group. The first thing that came out was what's going on with our investments. There was a really clear sense of if we've got money and that's being used to destroy the rainforest, then it's not worth us doing anything else. So then we kind of tasked one of the group to go and look into that. But the job wasn't, okay, go and make yourself a world-leading expert in sustainable financial investment and persuade the board they're getting it wrong. It was go and talk about the structures, through the structures we've already got. Speak to the finance director. Speak to Rathbones, who are investment advisors. Speak to the financial advisor and ultimately Aviva, who cover our non-NHS staff pensions. And when you do that, obviously the first thing I say is, yeah, you're not the first people to ask us these questions. Pretty obviously, that's going to happen. But actually, they can talk you through, and then you can work through their structures, take their advice. So Rathbones are saying, well, look, from where you're starting now, here's a really good off-the-shelf ethical policy that includes sustainability. We wouldn't be advising that if you fulfill these criteria, the return on your investments is going to go down. Because actually, when we spoke to our pension advisors, the ethical fund had been outperforming the default fund for the past 6 years. So we've been doing our staff a disservice by not making that the investment fund rather than these two things being in some competition. That wasn't the deal. You know, the deal was there are standards you can take, apply them, and then Rathbones was saying, oh, and by the way, we can give you some metrics to feed back on your investment so you can start having the transparency and awareness to think about what the next step was. And like I say, we've got governance structures, so that went to our finance committee, ultimately our board. Job done, that's the first step. But then within that green team group, there was then the much more practical stuff of, okay, so, you know, we've got Paul, who's the head of estates in there, and he can advise on recycling contracts. But then you've got someone saying, I think the gardeners actually already do some composting, so there's probably no reason why the tea bags can't be going in there as well, and all we need is a pot on a kitchen counter, which might sound like nothing, but actually these things show that people can make a change. You know, they're significant in driving that culture. And because we'd opened that group to everyone, there was not just Paul, but a member of his team who's a qualified electrician. So when we started talking about how do we do the behaviour change to turn the lights off more, you know, that guy was able to say, well, look, we kind of got halfway through fitting the motion sensors into the hallways and stairs, and there wasn't really any reason why we actually stopped that. It's just not at the top of my to-do list. And if we'd said to him, make that the top of your to-do list, chances are he'd have said, what am I not going to do then? Whereas when that idea came from him, suddenly whenever he has 10 minutes, he's popping up and fitting another sensor to start driving change much more quickly than if we'd done the top-down thing. And then the final thing that happened through that green team group was we started finding out we were doing things that no one else knew about. So, you know, we're very lucky, just over that ridge, you know, some of this land's managed for patients and families, and then there's some stuff that looks to me like rough grazing. But actually, it turned out we were already managing that for pollinators, and about a year before we had the conversations, someone in the local community had put some beehives onto it. So we were already starting that journey, just we'd never mentioned that. So our solution into that came from the group was, okay, let's do seasonal garden walks for the staff and volunteers. And that did two really powerful things. One, the volunteer gardeners who were in charge of that suddenly had that affirmation and that support, not as a top-down pat on the back from the leadership, but from their peers to say you're doing something amazing. But also, you know, coming back, that feedback loop, suddenly our staff get a real experience of something that the organisation is doing in terms of sustainability, feel more positive, feel like the values line up. So you're doing something good about that retention piece for your staff. And it's, you know, it's costing us nothing. It's just really positive engagement. So that's it. That's kind of all we did. It's nothing clever. It's just kind of finding some opportunities, empowering people to release those opportunities, making change. But it's felt like it's made a real difference. But I said I'd try and kind of subvert things a little bit. So yesterday, when we all sat here, about a mile up the road in Glasgow University was a conference on the economics of well-being, which the friend of mine that I was staying with was in yesterday when I was here. And one of the things that was said there was that care work is green work. And that really struck me when we were chatting last night. And obviously what they're not talking about is the massive superstructure of the NHS that probably has the carbon footprint of a small developing nation. Not saying that is inherently a carbon positive phenomenon, but if you think about the challenge that a lot of us are probably facing when we go back to our desks of there's a lot of system pressure, how do we get some people out of hospitals with care packages, and how do we stop the people who don't want to be in hospital getting into hospital in the first place in order to ease that system pressure? That's a challenge we've had for ages, but you can also see that as a sustainability challenge. Maybe the biggest single thing we can do, if you think about the trajectory of someone, their last year of life in frailty, who maybe gets blue lighted 3 or more times into hospital each time they have a fall. Because of their frailty, they then get stuck there for a week because it's really hard to get them back out. Eventually, they end up dying in that hospital because it becomes impossible to get them back out the last time, compared to the conversation we know that we're trying to have that says, you know, we know your plan is to die at home, you know that you're dying, and we're going to do everything we can to add life to your days, not do that adding days to your life thing by putting you into a hospital. you compare the carbon footprint of those two trajectories, and it's really bloody obvious which one of those you want to be happening from a sustainability point of view. And that might well be the biggest challenge that your executive committee are talking about in terms of how you support the system. But, my challenge back to this in terms of the business case is, what about the patient case? Maybe if we frame that, one lens on that is the sustainability agenda, we'll get a different set of ideas and collaborators. And, that problem that we've all faced for years now, we can start maybe seeing some different solutions and doing something different. So my challenge is, maybe we should stop arguing what the business case for sustainability is and start asking, what the patient case for not dealing with sustainability properly is. There we go, that's me.
Thank you. Paul, firstly, thank you. I've never been described as part of a stellar cast before, so you've certainly set the bar there quite high. And James, I really always love hearing about companies and third sectors' own journeys about sort of their own green journeys. I'm here with my colleagues from JDDK Architects, there's some colleagues in here today. We're going through our own journey here at the moment. We've set our own targets just a few years ago to be carbon neutral by 2030. It's going to be a real challenge. We're not quite sure exactly how we're going to do it yet, but it's an important part of the process that we need to go through. So a little bit about me. I'm a director at JDDK Architects. I'm an architect with a passion for environmental design, and I have been through the whole of my career. I'm also co-chair of the RIBA Northeast Sustainability Forum, which I find is a really important part of my role. It's a sort of a voluntary role, but it's really about helping other architects sort of come along the same journey that we are, and helping spread that sort of expertise around through the industry. JDDK Architects, if you don't know us, we're a Newcastle-based practice, although we do work across the whole of the UK and also Ireland. We've been in business for about 35 years, and over that time we've worked on over 50 hospice projects. And sustainable design has been one of the key parts of our practice since the very beginning. And of course it's more important now than it ever has been, particularly with the built environment contributing around 40% of the UK's carbon emissions. For me, it's really interesting to see how the language of building procurement is changing. A few years ago, it was all focused around things like, pounds per square metre. And we're still having those discussions when we're briefing our clients, but we're also starting to hear things like kilowatt hours per square metre and kilograms of carbon dioxide per square metre. And those are important changes that are really starting to happen in the industry, and rightly so, because our response to the climate emergency now will define, of course, as we all know, the lives of generations to come. As architects, really, we're doing what we've always done, just with slightly different tools. We're here to help clients make critical decisions around whether they should refurbish a building, whether they should demolish it and build a new building, what they can do to improve their building stock. And those decisions are always influenced, have always been influenced around cost and the business case of the project. But now it's also critical because so many of these clients have sort of carbon targets of their own. So as always, we're balancing issues of quality with sustainability and the client's budget. And what we always continue to do is to emphasize the important qualities of design that don't always show up, or should I say never show up on a spreadsheet. Issues around comfort, issues around well-being and delight in the buildings that we create. So what I'd like to do is just to show you a couple of slides, to show you a couple of projects that we've done, one that we completed a number of years ago and one that's on the drawing board now, and just to show a sense of the different approaches that we take to sustainability. So this is the first project I'd like to show you. This is, it's a 20-bed inpatient unit that we worked on for Sue Ryder at Thorpe Hall in Peterborough. It's a beautiful Grade 1 listed building, Cromwellian mansion with a beautiful walled garden. And the project reflects many of the common challenges that hospice estates are facing. So, for example, potentially an aging building stock, buildings that might be energy inefficient and carbon intensive. Couple that with high fuel costs that we're seeing today, super high energy bills, and then also the significant costs, the capital costs of refurbishment and building replacement. And there are many reasons why hospices, our clients, come to us asking for buildings with high sustainability aspirations. James has mentioned some there already. There could be carbon reduction targets set by staff or by trustees. There could be pressures from customers or from stakeholders, particularly those who have their own zero carbon targets. Or there could be statutory requirements. Obviously, improved targets are coming through the building regulations. And there could also be local planning considerations. And it was the last of these which was important at Thorpe Hall in Peterborough. The local planning authority had a requirement on us as architects to deliver a scheme that had, a good carbon reduction target above what was considered to be the baseline. So at Thorpe Hall, we achieved this with, as you can see just behind the wall of the walled garden here, we achieved this with a really well insulated timber framed building, which sits snugly into the walled garden of the listed building. We installed a ground source heat pump to decarbonise the building's space heating and hot water requirements, also to provide some cooling in winter to reduce or mitigate the impacts of overheating. And we ensured good levels of daylight and good access to really nice garden spaces, as we do in all of our projects. We used low impact materials such as cedar roofing and cedar shingles. And the west wing, which you can see in the background here, was fully refurbished to provide day services. That's all important in terms of recycling existing buildings. So in summary, the building was energy efficient, well daylit, made use of low carbon technologies. It was made using low carbon materials, low impact materials as well, which at the same time provided everything that a hospice building should. So the second project, this is one that's actually on the drawing board at the moment. This is a project that we're doing for Martin House Hospice, Martin House Children's Hospice in Boston Spa. The client already had high sustainability aspirations when they came to us, but we were able to help shape and guide those discussions through the briefing process. And we did this using the framework of the RIBA 2030 Climate Challenge, which you may or may not be familiar with. But the RIBA Climate Challenge has 3 key principles. And the idea is to guide buildings, the idea is to guide us towards making buildings that are essentially net zero ready by 2030. And there are 3 key aspects to that. The first of which is reducing operational energy use. Very simply, what comes through the meter. Secondly, monitoring the use or minimizing the use of embodied carbon. And that's the carbon that goes into manufacturing our buildings, the way that we are extracting and constructing materials, transporting them to site, maintaining that building and then demolishing it at the end of its life. And lastly, also controlling or avoiding overuse of water. A key part of our work for Martin House has been to emphasize the important benefits, the important co-benefits of sustainable design. So those often overlooked, but are actually really important and are quite often intangible. There are things like thermal comfort, providing a building that is comfortable, that has evenly heated spaces, and that comes from obviously providing a well-insulated building, draft-free. Fresh air, provided by a good ventilation system, and also well-insulated, well-designed, thermally efficient, airtight buildings often have a much greater building longevity just through the way that they're constructed, the way that moisture is protected or kept away from the building fabric. So we often see these sorts of buildings lasting a lot longer. So Martin House probably won't be able to afford or deliver on every one of these sustainable aspirations. And actually, that's not really the point, because our role as architects is to work with them through this process, prioritize their budgets, and work out what they can do. So, for example, one of the discussions we've had with them is over their heating system. Now, ideally, it would be lovely to provide all that hot water and space heating through the use of an electrified system, such as heat pumps, air source heat pumps typically. But unfortunately, air source heat pumps and renewable technologies in general do come with quite a high price tag. But actually, even if those air source heat pumps don't get put in now, by making sure the building is future ready for those, gas boilers may be put in initially, but when they come in, perhaps at the end of the lifespan of those gas boilers in 10, 15 years' time, the building is ready for a heat pump system. And what we're not doing is locking our client into fossil fuel use for the lifespan of that building, which hopefully will be 60 years plus. So just to round up, hopefully these two case studies give you a feel for the practice's approach to sustainable design. I'd like to just leave you with 3 priorities as an architect with a real passion for environmental design. So the first one, focus on energy efficiency. Energy efficiency first, before we start talking about bolting on renewables. So good insulation and maximize use of that ventilation as well. Secondly, decarbonize our heating and hot water through electrification. If you've got a choice, keep gas out of a building and go for heat pumps. And thirdly, don't overlook the embodied carbon of the materials that go into the building in the first place. The materials that go towards creating that building, they all have, I could say that as buildings become more efficient, for example, the embodied carbon of our buildings can take up possibly 1/2 to 2/3 of a building's total carbon footprint over its lifespan. So the upfront carbon involved in manufacturing that building is vital. We keep that low. And of course, that goes for existing buildings. Let's keep those in use as long as we possibly can through really good refurbishment and retrofit. Just before I hand over, for any of you who haven't seen our stand, we're here at stand A8. And I just mention that because we've still got some wildflower seed bombs which we're giving away. So if you haven't got one already, come and find us at the end of this. And we'll also answer any questions that you might have. Thank you.
Hi everyone, so I'll manage expectations as well. I have no slides, so you have to just look at me. Sorry. So my name's Kate, and I'm going to tell you a bit about the Palliative Care Sustainability Network, and I'm also going to speak to that brief of the business case for sustainable action. So to start with our sustainability network, I started this with some colleagues across the country last year, so we have partners in Wales, in Manchester, across the Southwest, really across the UK. And we started that with the help of the Centre for Sustainable Healthcare, which if you haven't come across, I strongly recommend you look them up. They're fantastic. And the aim of our network is to connect, develop and inspire sustainable practice in palliative care, greener palliative care. We've got just over 100 members, and we had our first event just last week, which was an interactive webinar, which was fantastic, and we got some really great ideas and connections going. And for me, as a palliative care doctor and a climate change activist, this has really been a culmination of kind of, I guess what I'd call like a 10-year journey. So I started out with the personal changes that I'm sure you can expect, got rid of my car, stopped flying, went vegan, met some vegans at the special people food section earlier, quite enjoyed that. I became a community activist, so got involved in my daughter's school, in the Residents Association, and really every single way that I could think of to try and drive the sustainability agenda. And if you were in the session earlier, one of the breakout sessions talking about community builders, and that person whose name comes up 4 times, that's me. Hi, I'm a community builder. And I got more and more frustrated, and I got involved in protest and did all the marches and those things that you might expect. And then I got involved in politics, and I've stood for the Green Party in council and in general elections. So I've really tried to put myself out there and drive that agenda forward. So when I started doing things at work, and in one of my previous jobs at St Joseph's Hospice, I was involved with their Green Journey, which sounds very similar to the example that you've heard here. It really feels like I'm bringing my whole self to work. This is me. I'm a palliative care doctor and I'm a climate change activist. And with the sustainability network, I can try and bring both of those halves together. So I'll tell you a bit about the business case, because I think there's such strong reasons for moving on this that I really want to make sure we knuckle down to that brief. So you've heard a little bit about the NHS Net Zero plan. So let me tell you just a little bit more about that. So that was enshrined in law in July through the Health and Social Care Act, and it's the first time in law any healthcare system has enshrined a duty to achieve net zero. So it's not just something that we need to be aware of, we literally have to do it. And that plan talks about the NHS's direct emissions, so what it can control, but also what it can influence. So this is their NHS Net Zero Carbon Footprint Plus, and it includes the supply chain and the commissioned services. So you can start to see the impact that it has on the people in this room. It includes buildings, includes transport, it includes energy, all of those matter. But actually clinical care is a big part of that carbon footprint too. So medications account for around 20% of that carbon footprint plus, so 20%. Medical equipment is 10%. And what I want to give you is the message that the people in this room, the people in the hospice sector, you're the experts in that. All of the stuff that you're hearing about, advanced care planning, admission avoidance, deprescribing, that is what good sustainable healthcare looks like. So we should be shouting about that. It's good clinical care, but it's good sustainable healthcare too. And we need to be banging that drum and sharing our wisdom. So that's the context that we have to work with. That's part of the business case. This is coming for us. We have to do it. So what else is important for the hospice sector? Well, having worked in it for well over 10 years, and it's been great to see some colleagues here who I've worked with in the past, wonderful. I know how much you rely on various forms of charitable giving. And you've heard about the importance of the sustainability agenda for your staff, but it matters to the general public too. And if you look at the surveys that are done about the importance of sustainability and environmental action, it's up at about 2/3 of people saying it's important or very important, and it's climbing. It's climbing. So when people are looking to somewhere to give their money to support, they're looking for a sustainability agenda. They're looking on your website. Where's the bit that says climate crisis on your website? Is it there? Because it should be. People are looking for it. So for me, in terms of a business case, we're into reputation. There's a reputational case. Are you part of the problem or are you part of the solution? That's a massive oversimplification, right? We are all part of the problem and part of the solution. But in terms of someone having a quick look, where's their money going? They want to see that you're acting on it. There's also potentially some opportunities out there. So I'm sure you've all heard of carbon offsetting, right? So you take your flight to go on holiday and you pay to plant some trees over there. We don't think too hard about whether the trees actually survive and whether they actually achieve anything and whether they were the right trees and whether they were planted in the right place. But never mind, it's all okay. So increasingly that's recognised as maybe not the best way to go about it, but there's an exciting move towards carbon insetting. So for example, where I live, our local council is starting to look at this, and that's the idea that if you're a business on your journey to carbon neutrality towards net zero, because they're subtly but importantly different things, instead of doing something over there, you do something within your own business. So you offset your emissions in your business by providing solar panels on your business. But there's only so much you can do within your business, so you start to look at your supply chain community, of which hospices may well be part. Your GlaxoSmithKline hospice might be part. So there's an opportunity to look at the idea of insetting and to work with your corporate partners that you might have on that. Definitely go out there and look that up. There's some really exciting stuff if you look just in the last couple of years about that. And then the other concept that I feel like everyone's talking about all day today but not naming is the idea of the triple bottom line. Is that a familiar phrase to the people in the room, the triple bottom line? So you've all heard of the bottom line, like, how much does this cost? The triple bottom line is the idea that for any activity that you're undertaking as your organisation, you're considering the financial implications, but you're also considering the social implications, and we've heard about poverty and end-of-life care, and you're considering the planetary health, the environmental considerations. So whatever you do, how much does it cost, but what is the impact on the people that we serve, and what is the impact on the planet? So that's a really important concept to bear in mind. And it's what you're all talking about in every session that I've been to today. But I want to just kind of take that concept and kind of explode it out a little bit more, because part of the reason that's a useful concept is it touches on the morality, the ethics, the people reasons why we have to act as a business on sustainability. Because we're in the business of patient care, fairly obviously. And for our patients, climate change in the UK already directly impacts on our patient care. And for those of you who were working in clinical care last summer, you took those calls from people that were struggling in the heat wave. You took those calls from people who were getting dehydrated. You were putting up bags of fluid in the community to support people dying at home. It's already directly impacting on our patients, so we have to be acting on it. Heat waves, air pollution, flooding, all of these things are already having an impact on our patients. And the other thing that we really need to be aware of is, I know there's so much talk about health inequalities. Again, it's coming up looking at the posters around homelessness. It's coming up talking about poverty, is that the most vulnerable are the most affected. And I saw a really profound example of this. I was lucky enough to get to come to COP26. So the last time I was in Glasgow was at COP26, and I was here with a community organisation, walking around the stands, and there was a researcher from Scotland, and she was doing a mapping exercise looking at coastal communities at risk of flooding from rising sea levels and mapping that against poverty. And guess what? The maps overlap. Because if you've got the money, you move out of the area that's going to be flooded. And if you haven't got the money, you have to take the housing in the damp, previously flooded areas. So we know that those inequalities are amplified by climate change. So if we're in the business of good patient care, delivering a good death, we need to think about mitigation. So that's the phrase that's used for reducing our carbon emissions, but we need to think about adaptation as well. So you've heard a little bit about what a modern hospice might look like, but it's things like the nursing homes that you serve. Have they got air conditioning? Have they got shade in their garden? I looked after a patient this summer in a homeless hostel with a fungating wound and no air conditioning. Really dreadful conditions. So if we want to achieve good quality patient care, we need to be thinking about the environmental impacts and how we can work on that. So morally and reputationally, we know we need to act. And we know we see it locally, but we are part of that global whole. What we do in the UK matters. Our carbon emissions matters. The leadership that we take matters. And I know people will say, what about China? What about the USA? Okay, fine, but what are we going to do? We can't influence that. The only way we can influence it is by saying, okay, well, this is what we're trying to do. And I found the comment about staff and retention actually really powerful, because particularly in the cities, I know that your workforce will be diverse, and some of your workforce will come from communities struggling much more with the impacts of climate change. It really matters to people. They really understand what these issues are, and we are not serving our staff if we are not addressing and speaking to those issues. So for me, that's the context around the business case. There's the NHS context that we're working in, and that requirement that we really must be acting. There's the financial challenges and the opportunities. There's the reputational challenges, and there's really a strong moral case to act. So I found the slogan of this year's conference, Finding a Way Forward. It's on the screen in front of me. It's up there, Finding a Way Forward. So what we're trying to do in the Palliative Care Sustainability Network is support each other to find a way forward. And one of the first things we did when we got together with our members is we tried to crystallise what our members were saying about their own sustainability journeys into a model that we could share with you. So I'm gonna talk you through it. I've deliberately not put it on a slide because I want you to have to email me. I want you to have to get in touch to get it. I don't want you to take a picture. So the ways you can get in touch is via the Centre for Sustainable Healthcare Networks page. That's one way. Via Twitter at the moment. Let's just see what happens with Twitter. But at the moment, PalCare Susnet on Twitter. We have a Facebook group, and then we've got a really easy email address. So PalCare Susnet, PALL care, SUS, net, @gmail.com. So I'm going to talk you through the model, but if you want the nice graphic, you're going to have to get in touch. So it's a 5-step model. This is what we've come up with. So step number 1 is you join something or you form something. So you start your green group, you start your eco committee, you get that grassroots people in. And if you're in a hospice setting, ideally you get someone from senior leadership, senior management in as well. So you've got all of the people represented in the room. And when I say all of the people, I mean all of the people. You need the clinicians, you need the shop managers, you need the facility staff, you need the admin staff. But they'll be out there. They're the people going, oh my God, I'm so annoyed about the plastic forks in the canteen. They'll be there and they'll be ready to join you. You do it within your organisation, and you also look outside. So what's happening in your NHS commissioning world? What are the sustainability groups? What are other people in? How do you make those connections? Because every NHS trust in England has an NHS net zero plan, literally every single one as of this year. So there will be someone in your partnering organisations that you can reach out to. So that's the first thing you do. You form something, you join something, you get together. Then this is my personal favourite, step 2, is you put sustainability on the agenda, literally. So every time you have a meeting, whatever that meeting is, sustainability becomes a fixed agenda item. And this is where you'll start to get those grassroots ideas. Okay, agenda item number 3, sustainability. Anyone got anything to say? Just give it a beat and all the ideas will come. And that's what you feed in. That's where you get people talking about it. And you also use it as a way to talk about climate change and health. Because one of the really big problems that I know we all struggle with is, I haven't got time, I don't know how to do it, and it's not my job. And I hope I've started to make the case for you that it is our job. It's really important to our patient care. So it gives you an opportunity to talk about that as well. So that's step 1 and step 2. Step 3 is a quick project. So this is that language of easy wins. So you'll know what the quick project is in your organisation, but the examples might be something that you're doing with your hospice shop. It might be something around investment. It might be getting your board to declare a climate emergency. But you do something and you name it as a sustainable action, and then you share it and you celebrate it. And then within our network, we're quite focused on clinical issues at the moment. That may change. We'll see what our members want to do. So the next step is to look at sustainability and quality improvement. So the Centre for Sustainable Healthcare have courses on this, which you can take, which are fantastic. And they show you how to embed, whenever you're doing quality improvement or change management, how do you embed a sustainable element into that? And I'll just share with you what we've done recently as a network, which is we've worked out the carbon footprint for anticipatory prescribing for one patient. And there's an excellent poster by St Christopher's. We've done a similar project looking at waste. So if you do 10 ampules of the standard, morphine, midazolam, glycopyrrolate, haloperidol, the carbon footprint of that for one patient is 12 kilograms of CO2, which is probably fairly meaningless to all of you sitting here, and it's the language that I'm getting familiar with. That's equivalent to driving 38 miles. 38 miles. And we know for some of our patients that never gets used. So would you get in your car and drive 38 miles for no good reason? I don't think you would. I think you'd recognise that as a massive waste and a horrible air pollution generating thing that you just definitely wouldn't do. Now, I'm not saying we shouldn't anticipatory prescribe. Of course we should. It has massive benefits. But what are the systems that surround that? Why do we do that so far in advance? Is it because our out-of-hours system isn't up to scratch? Is it because we haven't got a kind of just-in-case box we can go to within our hospice that we could get an extra dose of something? Does everyone really need antiemetics, or maybe only the people who are being sick or who have been sick in the past? Or maybe we could do 5 ampules instead of 10 if we're not really sure. It's a conversation starter around clinical practice and the role that that has. So, 4 steps. Join, put it on the agenda, do a quick project, do a sustainability, slightly more in-depth project, and then the final step, and for me this is really important as well, is you celebrate it and you share it and you get all of your comms team involved and you get it badged everywhere, labelled everywhere as this sustainable action that we did, something that we did together, a step on our journey, a step towards sustainable palliative care. So I will stop talking and hopefully there's loads of questions.
Thank you very much, and some really, really interesting food for thought, I'm sure, there. I'm now going to consult the iPad in front of me. So we've already had a couple of questions in, presumably through you guys in the audience using Slido, but also those joining on the live stream. So I'm going to kick off with this question. Hang on a moment. Someone has asked about the question, probably for you, Kate, around the wastage of drugs. So when will we be able to reuse and reallocate expensive drugs and medications?
Well, I can't answer the when, but I can tell you that it's starting to happen. So there's someone whose name escapes me, who's just got funding to create the green BNF. So it will literally be a BNF that you will go to, and it will tell you the carbon footprint of what you're prescribing. And thinking about that triple bottom line, it will mean you'll think, right, what's the right drug for my patient? Clinically, okay, there's equipoise between this drug and this drug. You might have looked at the cost, but now you'll be looking at the cost and the carbon footprint. So that's really exciting. So I think it was last week, that someone's literally just got funding to start that project. But if you kind of search for greener BNF, you might find them.
Sorry, I asked a question. It wasn't just so much about the cost of it, it's about the cost of not using it when it can be used elsewhere.
Okay. So I can also answer that. So I went to an event by an organisation, I think they're called Pharmacy Declares, who are the pharmacy branch of sustainable practice. And the challenge with waste is how medications have been stored. So the reason they can't be reused, this is my understanding, I'm not a pharmacist, is because you can't guarantee the way they've been stored. But there is work going into having small, also not an IT specialist, I'm going to say chips, small chips in the packaging so that you can see that that product's not exceeded a minimum or maximum temperature. And that might be the pathway to being able to reuse medication that's not been opened.
Yeah, I mean, there is technology now for blister packs to guarantee what the medication is, its date, its sell-by date, its provenance. The technology's there to reuse them without any problem whatsoever.
Yeah, so that's coming. And I also found out recently that you can recycle blister packs at Superdrug stores. Didn't know that. There you go. I'll stop talking for me.
Thank you very, very much. And a question for James, I think. Did you try to, just jumping about, did you try to measure your starting point when embarking on your sustainability journey, i.e. looking at your existing carbon footprint?
We started doing some benchmarking on our carbon footprint with a local third sector organisation collaboratively. What we didn't actually get was the output of that project because we struggled to supply some of the data that was needed to do it. So we tried, and to be honest, we failed. So I think that we're still expecting that to come along to let us know, where we're at. But I think while that's really important to start with a baseline and measure your improvements, if you know that you're making things better, and it's a cliche, but acting like your house is on fire, well, do something good rather than waiting another 6 months for the data team to be able to output certain parts of the consideration into that was the conclusion that we got to. But we should have done. It would have been better if we could. It was one of those barriers we decided we were going to work around rather than try and wait for.
Yeah, absolutely. Definitely not something to hold out for, and you can definitely crack on with some positive action without having done that. I mean, certainly speaking to hospices over the last few months, this is something that has really come up in many of my conversations around being able to set that baseline, work out what that baseline is, to then be able to identify what change can we implement that will actually make the most difference. But like you say, not always easy to come up with that data, and definitely shouldn't be a barrier to actually kickstarting some action right away.
Paul, can I jump in on that? Just for those people who may be sort of considering refurbishing or building new hospice buildings, one of the really simple things you can do from a benchmarking point of view is very simply just, obviously, as part of your carbon footprinting, you're going to be taking a note of your sort of gas meters, your electric meters, and so on. Just very simply, take your building's energy readings for the year, gas, electric, total it up and divide it by the size or the footprint of your building. And it just gives you a benchmark that you can compare with other hospices. But more importantly, you should be able to compare that to sort of industry standards out there. So, we know what good buildings should be in terms of, for example, kilowatt hours per meter squared, what a good building looks like. And when you're speaking to your professional teams, you should be able to have those discussions with them about how to start to reduce that carbon footprint.
Great, thank you very much. And a question has come through, which is very timely. So what is Hospice UK planning to do to support sustainability in hospices? So we're going to round off with some of the key things that we are doing and launching in this space at the end of the session. So very much not dodging that question, but it will come as we close. So moving on to the next one. Someone's asked a question about the carbon footprint view of IPU versus home care. I don't know if anyone's got any comments on that.
I can speak to that. So the straightforward answer is we don't know. There's a hospice who's, I always forget which hospice it is, forgive me, it's the Sue Ryder Hospice, who's just published their carbon footprint. If you're in the room, I'm so sorry, I can't keep which hospice it is in my head.
I think it's Sue Ryder Wheatfields, I believe, but I'm not
Yeah.
wrong.
So if you Google carbon footprint of a hospice, you'll find that. So we have, and it's starting to emerge, the data for the carbon footprint of an inpatient hospice. The challenge for community care is, if you think about that concept of carbon emissions that you directly control and carbon emissions that you influence. So if someone's in their home, what you can't straightforwardly influence is how carbon efficient that person's building is. So what their heating costs are, what their electricity costs are. And we heard in the session this morning about some of the challenges around that and people in social housing or perhaps poor quality rented housing. So lots of barriers there. The thing that we haven't spoken about that you can influence as a community team is how you're getting to your community visits. So there are some hospices who've got electric vehicles. It's actually a really good model, hospice care, because generally you're taking the hospice's car out and you're going out and you're coming back and it's staying overnight. So transitioning to electric vehicles is one thing. If you're in a smaller geographical area, so my team are working towards electric bikes and cargo bikes. And one of our network members, who's a paediatric palliative care consultant, Fenella Craig, who cycled to COP26 from London, which she told me she wasn't a very keen cyclist. Someone just came up with the idea and she hadn't really realised how far it was. So she's got this fantastic story of taking one of her community nurses out in a cargo bike. So Fenella Craig cycled and the community nurses in the cargo bike. I'm not sure we're all going to be doing that, but there are some creative ideas out there. We've got in my trust, Guys and St Thomas's, we've got district nurses now moved to neighbourhood nursing teams, so everywhere is within a 20-minute walk, and they're starting to use electric bikes and panniers to take their equipment with them. So there's some exciting stuff happening, but transport is the one thing I would think about for carbon footprint of community work that you can influence directly.
Interesting, thank you. Just a quick one, I think someone's asked if you could just share your Twitter handle again.
Sorry.
That's right,
So
Kate.
it's at palcaresusnet is the Twitter handle, pal with a double L.
And then a question on water. So someone's asked, what advice does the panel have on reducing water wastage in hospices? Don't know.
I could jump in on
Yeah.
that. Well, obviously, as JDDK, we're based in Newcastle, and I can tell you we don't typically have a shortage of water in the region. Certainly, when neither does Glasgow, judging by the weather today. But one of the a lot of people come to us and say, well, why is water saving important? Particularly when we don't necessarily have an issue with drought in our region. But actually, one of the biggest issues is when you have buildings that are energy efficient and their space heating demand is shrunk right down as much as you possibly can. Actually, the demands of hot water generation, particularly in healthcare buildings, is really it's really considerable. And so saving water is often really just about saving energy. And there's loads of ways to do it, certainly from a building perspective. I mean, you may have anything to add, but certainly in terms of things like water-saving fittings, there's loads of great products out there that, we can have discussions about. There's loads of options. I don't know if you want to add anything.
Not particularly, no.
I mean, for us, that was about thinking about our supply chain. So we identified that things like our laundry were quite a significant water consumption. We do a small amount of that in-house. So when the machine was due for replacement, get a more efficient one. That makes sense. But then thinking about, well, when's that laundry contract up for renewal? And what's going on with that provider in terms of their use within that. So, talking about your role within that supply chain as the procurer of services felt like a really important step for us, as well as looking at what we were doing directly.
Super, thank you very much. And then a question that's had a couple of likes is about NHS compliance, I guess. So touching on what you mentioned, Kate. And so many hospices receive lump sum grants, aren't yet subject to NHS contracts and those green compliance issues from a legal perspective yet. But can a typical sustainability questionnaire mentioned by UK be shared to give a flavour of the rig we might expect going forward and provoke some ideas about what to aim for?
I don't think it was me. I think it was you that mentioned the sustainability questionnaire, so go for it.
Yeah, I mean, we can share with you what we've got. In our case, that was coming from our local council, who declared a climate emergency, rolled it through their procurement practices. I can certainly, if anyone wants to contact me, I'm james.byron at dorothy-hospice.org.uk. If you can remember all of that, but you can probably find me on Google or Twitter. So there's what we're facing coming from some commissioners, but as everyone says, not all. But then in looking at our own procurement practices, starting to think about, well, what's the standard practice so that when that does come, we can flow it through our supply chain. So, there's kind of two sides to that dynamic, and I'd gladly share.
Yeah, and hopefully at the end as well, we'll be able to talk to you about how we might share some of these resources as a sector more easily as well. So, we'll definitely make sure that's added. Thank you. And then a question about shops, probably more for you, James, right now, but maybe Adam to chip in as well. But James, you gave a great example of Dorothy House's work at its main hospice site, but also you have 25 shops. So what are you doing about those, as obviously collectively they can have a significant impact, but obviously harder to manage as well?
Yeah, so there's a few things. So the first part of any kind of green hierarchy is you reduce. So when you look at those shops, there's, what's going on with the things like energy consumption within the premises, but also, running marketing campaigns to try and say what we want is high quality donations, not just you clearing out your house into those shops. Because one of our big issues with them is we get a lot of donations that we can't use. Value of rag has kind of dropped off a cliff. That's not the thing it once was. And our current recycling contract, to be honest, isn't very good. It's up for renewal in October, and we're looking to make it a lot better. But actually, how do we reduce the amount of waste that's going in, and then how do we make sure we've got a better recycling contract for the stuff we can't reduce against is important. But then the same process that I talked about. So there were representatives of our shops in that group who'd come forward. And when you go around, actually outside of those waste contracts, people, you talk to people and suddenly like, yeah, of course I could take the milk bottles home and recycle them. They say everything just goes into one bin in the office, the upstairs, the sorting area. And then as soon as you say to them, well, we can probably give you a pot, they're like, nah, it's all right, I'll just sellotape a label onto it and I'll take it home myself. If we tried to mandate that volunteer to take home the recycling and recycle it at home, they'd never do it. As soon as it's their idea, they're like, yeah, of course I can sort that out. So, that empowerment thing to just make the small changes that you can as well, in places like retail has felt really important too.
Great.
Yeah, I can jump in. Perhaps I can go just one step before. You sort of mentioned the first step is reduce, but actually you've got to measure it. So if you don't measure it, you can't reduce it. So, every business should be doing this. And certainly at JDDK, we've been doing it for about 3 or 4 years now, just because we have, sort of dealing with clients who expect that of us. From a sort of retail point of view, as with any building estate, there are some really good carbon management software packages out there, which will build sensors into your energy management. It's very popular, for example, in the education estates, where you can have a dashboard that looks at where energy is being used across your estate and actually look for the easy wins, because that's really where you want to start. Look at the easy wins of where you can target energy, and it's normally about where energy is wasted. So, for example, our lights being left on, fridges unnecessarily being left on, and so on.
Can I jump in there as well? Ooh, this is great, everyone's answering. So I'd put a different step before reduce, which,
Yeah.
So reduce, reuse, recycle, I go for refuse, reduce, reuse, recycle, rot. So if you're running a hospice shop and you're selling new products, what are those new products that you're selling and how sustainable are they? And to name a different charity, if you look at Oxfam's shops, they sell a lot of things made out of recycled, upcycled materials. So just being quite critical about what else you're selling might be another thing to look at.
Yeah, and another example I've just remembered from our last retail conference that was shared by one of the team and then the other shops picking it up was we have furniture shops getting rid of old sofas that aren't selling, costs us like 50 quid a sofa, and then they basically go into landfill. Whereas turns out if you stick them out on the street with a sign saying they're £1, they sell incredibly quickly. So people aren't buying them for 50 quid or £100. But as soon as you can save yourself £49 in that shop's financial language, but also you're getting that thing back into use for someone who couldn't afford it at the rate, but actually that's going into a home that it's making better, and those are tiny things, but they still feel really positive, and they're just things people can do right away.
Yeah, absolutely. And this question, I love as well because it brings sustainability into the entire operational footprint of a hospice. It's not just something for estates to think about. It's not something just for clinical to think about. It's very much across the entire organisation. And again, this should be how we're talking about sustainability in the same way, Kate, you mentioned adding sustainability to the agenda every meeting. This can't be a siloed area of work. So, I will certainly be thinking about that in terms of what everything Hospice UK does in terms of how it supports different areas of hospices work across the UK, how we feed this topic into all of those conferences, conversations, webinars, resources, whatever it is we're producing, so that we can kind of tackle this holistically. And then a big thorny one, but is very much on my agenda, having spoken to hospices recently, and I'm sure lots here, is how do you go about starting to calculate the carbon footprint of your organisation? How can you do it in a way that is achievable, realistic, not too expensive, but still meaningful?
Do you want to start?
Well, I can tell you a bit about our own journey. It's actually been really straightforward. Very simply, we had a member of staff 3 or 4 years ago who we sent on a carbon footprinting course. And that's one of our architects who's really taken it under her wing. And we've invested in a piece of software. It's an online piece of software called Smart Carbon. Fantastic bit of software. We very simply, choose the scope of our carbon emissions, and we fill our data in every year. Actually, we fill it in every 6 months. And then, talking about the discussions you've had earlier on about celebrating that, what we actually do is we measure our carbon footprint, and then we put it on our social media so people can see, have we had a good year? Have we had a bad year? It's about sharing that journey. Out of interest, the person who runs Smart Carbon, and this isn't a shameless plug because I have no affiliation whatsoever, also works for the Newcastle NHS Trust as part of their team working towards zero carbon in 2040.
Brilliant. So the things I would add is, there's definitely other organisations out there. So the Carbon Literacy Trust is another one. Centre for Sustainable Healthcare have a carbon footprinting network, like we have our palliative care network. So when I was trying to calculate the anticipatory prescribing costs, I got their advice on how to do that. So there's help out there. But for me, it's about becoming familiar with the language. So, for example, what's the carbon footprint of the average person living in the UK per year? Anyone know? There's about 10 tonnes of carbon. So starting to get your head around what the figures are and what they mean. So maybe working out your own carbon footprint. And if you just Google calculate my carbon footprint, there's a variety of tools from sort of fairly basic, where you're just kind of sticking in your energy bills and how much you drive and how much you fly, to really quite detailed ones that ask you lots of personal questions, like how many bars do you take, stuff. But getting familiar with the concept is a really useful first step if this is going to be part of your role. And then for clinical care, so the Centre for Sustainable Healthcare produce what are called carbon emissions factors. So for pieces of medical equipment, so for general medications, for bedding, for laundry, for all of these things, they'll give you basically a kind of rough estimate of what the carbon emissions factor is. So you work out how much you're using, so basically the cost, you work out the carbon emissions factor, and then you get a rough idea of what the carbon footprint is. So if you're interested in something, you can contact us and I will share with you the document, or you can find it on the Centre for Sustainable Healthcare's website, and you can just have a go, just have a play, get familiar with that language. For me, that's the first step. But I don't know if you want to add from your journey as well.
As I've already said, we were quite a poor example of that, but for us it was the Energy Saving Trust, local contacts there. They actually had funding to work with third sector organisations to help footprint them. We was one of those moments where it just wasn't possible to get all of the data that we wanted. But yeah, you know, I think it's the main thing. It's not about necessarily trying to develop all of this complex expertise in-house in the first instance. It's about reaching out, working in partnership and using that as a learning tool. That was certainly the journey we're on and are still on, because we're still learning how to do it, you know.
Absolutely, thank you. And then, not sure what the answer is to this one, I'm sure there are some, but are there any studies out there on the impact of PPE on the environment, I guess, especially as we move
Yeah, I
on
know a
to
bit
COVID?
about that. Not a lot. I can give you a good mental image. So at our webinar last week, we had, I think his name is Nick Martin, who's the Sustainability Officer for Great Ormond Street, came to speak to us about their journey, and they've got some really exciting stuff going on. Because they're a children's hospital, they shared the number of gloves they use in a year as the number of Tyrannosaurus Rexes. So it was 3 T-Rexes worth of gloves, which is quite impressive. So there is published stuff out there about what the tonnage of CO2 is for kind of NHS trusts, gloves requirement, PPE requirement. So you can find that data. The thing I would direct you to, actually, one place to find lots of this information is there's a Gloves Off campaign, which I think the NMC have been involved with. So if you Google Gloves Off, it gives you guidance about when you do and don't need to wear disposable gloves. And that's something that lots of trusts have started to share and develop their own version of. Just to give people that permission, you don't need to be wearing gloves. So subcutaneous injections, for example, you don't need to be wearing gloves for. So I'm not that familiar with the literature, but it's out there, and if you look at Gloves Off, you'll probably find it.
Super, thank you. And I think probably time for one last question. Probably more for you, Adam. What do you think is the way forward with Powerwalls and solar panels when the excess generation rate for supplying back to the grid is so low versus the usage in kilowatt hours of income for supplying excess to the grid?
Yeah, it's a really good question. I would take you back to one of the sort of summing up points that I made, which is really we should be focusing, before we start looking at renewables, we should be focusing on energy efficiency. The kilowatts we save is much better than the kilowatt that we've generated, because actually solar panels and batteries themselves have really high embodied carbon. So we should be focusing on embodied carbon, but there is a place for, certainly is a place for battery storage, for PV panels, particularly for charities. There are companies out there that do PV leasing. So, you know, for very little cost, you know, you can get PVs on your roof and make free use of that electricity. In terms of battery storage, yeah, battery is not always the answer. There are other ways you can store that heat. So you can store that heat in hot water. Hot water is definitely something you're going to be using a lot of. So yeah, don't always assume that PV and battery combos is the right way to go, but it definitely has a place in the way that things are going. What I would say finally is that as well as one of the things that we tend to get hooked up on when we start to set our own carbon footprinting and set our own zero carbon targets is that we think that zero carbon is for us in our sort of little isolated business building community, whereas actually what we're really talking about is zero carbon in a broader sense. And actually, once you start to appreciate that, you realize that some of the initiatives around load sharing become much more important. So that's, for example, you'll be aware of the Octopus Energy's studies at the moment, looking at how people can be paid not to use energy at a particular time. And so actually that very clever load management, you know, actually for very little cost without the investment of batteries starts to achieve quite the same thing.
Thank you so much. Yeah, lots of terrific insight there. I mean, for me, some big takeaways. I mean, James, you mentioned about that. I think the internal coalition of change makers, I really love that as well. And definitely that starting that culture of change really begins with one person's action, which I think is, yeah, fundamentally important and really, really crucial. So thinking about that internal mobilisation of staff on this issue. And then Adam, you know, all of your insight around kind of the building footprint. I mean, for me, what really resonated was the kind of the other when thinking about this business case, the co-benefits of sustainable build, sustainable design, so things like having more even heating and the kind of longevity of the building, as well as simply the cost and then the impact on the environment, of course. And then Kate, some great stuff shared there. Thank you. I love this kind of concept of kind of carbon insetting, thinking about climate change's impact on our patients. You know, this is the here and now. This is not something that's just happening far away. So really that clinical business case. So hopefully you've heard some different perspectives on the overall business case for why hospices should be addressing this particular topic. But I wanted to close with just kind of what we can be doing next as a sector. So if we just put the final slide up. Wanted to just talk through some of the things that Hospice UK will be leading and working on in this area now. So first of all, we've developed an environmental sustainability for hospices group. So if you scan that top QR code there, you'll be taken to a web page on Hospice UK's website where you will be able to join an online forum where we really hope to connect hospices on this topic, and we really encourage people to share their questions, just like they've been doing today after this session, share their challenges, share their successes, all of the documents and, you know, James mentioned your kind of what you wanted to share, we can make available on that forum and easily access. We've also got on that webpage a link to the Palliative Care Sustainability Network that Kate was talking about. So please go onto there, join the forum, join the conversation. And then secondly, share it with your colleagues. You're obviously here in this session for a reason that you've probably got personal reasons for, that's driving you to really address this issue, but you will have colleagues all around you in your organisation, I'm sure, if you haven't got green teams already, people who can join that forum. That's for anyone in the hospice sector. And then finally, as well, to kind of kick things off, we've got some support from the Rank Foundation. We have a pot of £100,000 that we'll be able to allocate as hospice grants. So this won't be the be-all and end-all to of your kind of sustainability work, and is very much the tip of the iceberg for us. But we're really pleased that the Rank Foundation has provided some money to kind of kickstart this conversation for hospices. So there'll be grants of up to £20,000 for hospices to apply for, to help you implement measures and to reduce your environmental impact as a hospice and deliver more sustainable healthcare. So thank you so much for coming along. I just want to, I guess, close and end by saying that this, I know, can feel quite overwhelming and quite a big topic. There are so many other priorities out there now for hospices. We totally understand that. But I think that by working together and collaborating and sharing what we've learnt, sharing what's gone well, what hasn't gone well, will help all of us on this journey. And soon all those little steps we're taking will, I think, have a huge impact across palliative care and wider healthcare. So thank you very much.